Today, the book discussion is on schizophrenia and other psychotic disorders in ICD 10 versus ICD 11 and DSM. It's moderated by Dr. and presented by Dr. Hamid. Introduction: the diagnostic system international classification of diseases developed by WHO and diagnostic statistical manual developed by American Psychiatric Association. It conceptualized the mental psychopathology in mental disorders. ICD and DSM have enabled the diagnosis to be made, treatment to be applied, and prognosis to be postulated. ICD 11 and DSM 5 share great similarity in the conceptualization of schizophrenia with respect to those of ICD 10 and DSM 5. It helps to improve the utility of the disorder and to make ICD 11 criteria similar to DSM 5. ICD 11 describes the psychotic disorders in a block of schizophrenia spectrum and other primary psychiatric disorders. It includes schizophrenia, schizoaffective disorder, schizotypal, acute and transient psychotic disorder, delusional disorder, and other primary psychotic disorders. As per ICD-10, the diagnostic criteria is thought echo, thought insertion or withdrawal, and thought broadcasting. Delusions of control, influence, or passivity clearly refer to body or limb movements or specific thoughts, action, or sensations, and delusional perceptions. Hallucinatory voices giving a running commentary on the patient's behavior or discussing patient among themselves, or other types of hallucinatory voices coming from some part of the body. The fourth criteria is persistent delusions of other kinds that are culturally inappropriate and completely impossible, such as religious or political identity or superhuman powers and abilities. Example being able to control the weather or being in communication with aliens from another world. Persistent hallucination in any modality when accompanied either fleeting or half-formed delusions without clear affective content or by persistent overvalued ideas or when occurring every day for weeks or months or on end. Breaks or interpolations in the train of thought resulting in incoherence or irrelevant speech or neologisms. Catatonic behavior such as excitement, posturing, or waxing waning flexibility, negativism, mutism, and stupor. Negative symptoms such as marked apathy, paucity of speech, and blunting or incongruency of emotional responses, usually resulting in social withdrawal or lowering of social performance. It must be clear that these are not due to depression or neuroleptic medication. And a significant consistent change in overall quality of some aspects of personal behavior, which manifests as loss of interest, aimlessness, idleness, a self-absorbed attitude, and social withdrawal. The normal requirement for a diagnosis of schizophrenia is that a minimum of one very clear symptom, and usually two or more, if it's less clear cut, belonging to one of the group of A to D above, or symptoms from at least two of the group referred to as E to H, should have been clearly present for most of the time during the period of 1 month or more. Conditions meeting such symptomatic requirements, but of duration less than 1 month, should be diagnosed in the first instance as acute schizophrenia-like psychotic disorder and reclassified as schizophrenia if the symptoms persist for longer periods. The 1 month duration criterion applies only to the specific symptoms listed above and not to any prodromal non-psychotic state. The course specifiers. The course of the schizophrenic disorder can be classified by using the 5 character codes. It can be continuous, episodic with progressive deficit, episodic with stable deficit, episodic remittent, incomplete remission, complete remission, and other. Course and certain period of observation too short. The categories of schizophrenia are paranoid schizophrenia, hebephrenic schizophrenia, catatonic schizophrenia, undifferentiated post-schizophrenic depression, residual schizophrenia, simple schizophrenia, other schizophrenia, and schizophrenia unspecified. According to ICD-10, the schizotypal disorder, there is no dominant or typical disturbance, but any of the following may be present. Inappropriate or constricted affect, behavior or appearance that is odd, eccentric, or peculiar, poor rapport with others and tendency to social withdrawal, odd beliefs or magical thinking influencing behavior and inconsistent with subcultural norms, suspiciousness or paranoid ideas, obsessive rumination, schizotypal disorder. Suspiciousness or paranoid ideas, obsessive ruminations without inner resistance, often by dysmorphophobic, sexual, or aggressive contents. Unusual perceptual experiences, including somatosensory or other illusions, depersonalization, or derealization. Vague, circumstantial, metaphorical, over elaborate, or stereotype thinking manifested by odd speech or in other ways without gross incoherence. Occasional transient quasi-psychotic episodes of intense illusions, auditory or hallucinations, and delusion-like ideas usually occurring without external provocation. 3 or 4 of the typical features listed above should have been present continuously or episodically for at least 2 years. Persistent delusional disorder. This group includes a variety of disorders in which long-standing delusions constitute the only or most conspicuous clinical characteristic and which cannot be classified as organic, schizophrenic, or affective. In delusional disorder, it is characterized by development either of a single delusion or a set of related delusions which are usually persistent and sometimes lifelong. The delusions are highly variable in content. The onset is commonly in the middle age, but sometimes, particularly in case of beliefs about having a misshapen body in early adult life. Delusions constitute the most conspicuous or any other clinical characteristic. They must be present for at least 3 months and be clearly personal rather than subcultural. Depressive symptoms or even full-blown depressive episode may be present intermittently, provided the delusion persists at times when there is no disturbance of mood. And then there is other persistent delusional disorder. This is a residual category of persistent delusional disorders that do not meet the criteria for delusional disorder. Disorders in which the delusions are accompanied by persistent hallucinatory voices or by schizophrenic symptoms that are insufficient to meet the criteria of schizophrenia are coded in this category. Then there is persistent delusional disorder unspecified. Acute and transient psychotic disorder as per ICD and brief psychotic disorder as per DSM5. The order of priority uses the acute onset within 2 weeks as the defining feature of the whole, the presence of typical syndromes, and the presence of associated acute stress. The acute onset is defined as a change from a state without psychotic features to a clearly abnormal psychotic state within a period of 2 weeks or less. The typical syndromes that have been selected are firstly the rapidly changing and variable state and are called as polymorphic that has been given prominence in acute psychotic state in several countries. And second, the presence of typical schizophrenic symptoms. Associated acute stress can also be specified with a fifth character if desired in a view of traditional linkage with acute psychosis. Complete recovery usually occurs within 2 to 3 months, often within a few weeks or even days, and only a small proportion of patients with these disorders develop persistent disabling states. The categories of acute transient psychotic disorder include acute polymorphic psychotic disorder without symptoms of schizophrenia, acute polymorphic psychotic disorder with symptoms of schizophrenia, acute schizophrenia-like psychotic disorder, other acute predominantly delusional psychotic disorders, other acute transient psychotic disorders, and acute and transient psychotic disorder unspecified. Induced delusional disorder, a delusional disorder shared by 2 or more people with a close emotional links. Only one of the people suffers from a genuine psychotic disorder. The delusions are induced in the others and usually disappear when the people are separated. It includes folie-à-deux-induced paranoid and psychotic disorder. Schizoaffective disorder as per ICD-10 A diagnosis of schizoaffective disorder should be made only when both definite schizophrenic and definite affective symptoms are prominent simultaneously or within a few days of each other, within the same episode of the illness, and when the consequence of this, the episode of illness does not meet the criteria of either the schizophrenia or a depressive or manic episode. It includes a schizophrenia disorder manic type.
Last two lines. No, sorry. Schizoaffective. Last two lines. And when?
The consequence of this, the disorder of the illness does not meet the criteria of either schizophrenia or a depressive or manic episode. Schizoaffective disorder manic type, a disorder in which the schizophrenic and the manic symptoms are both prominent in the same episode of the illness. The abnormality of mood usually takes the form of elation, accompanied by increased self-esteem, grandiose ideas, but sometimes excitement or irritability are more obvious and accompanied by aggressive behavior and participatory ideas. These are the subcategories: schizoaffective disorder, depressive type, mixed type, and other schizoaffective disorders. Schizoaffective disorder unspecified. But according to DSM5, schizoaffective disorder, an uninterrupted mood of illness during which there is a major mood episode congruent with the criteria of schizophrenia, delusions or hallucinations for 2 or more weeks in the absence of a major mood episode during the lifetime duration of the illness. The symptoms that meet the criteria of a major mood episode are present for a majority of the total duration of the illness. The specifiers are the bipolar type and the depressive type. Then there's unspecified non-organic psychosis. This category should be used for psychosis of unknown etiology. It includes psychosis in. Now ICD versus ICD-11, ICD-10 versus ICD-11. In ICD-11, made changes to ICD-10 diagnostic criteria of schizophrenia, removing of the preponderance of the Schindler's first-rank symptoms from ICD-10. ICD-10 gave almost a pathognomic value to these clinical symptoms, considering single symptom was sufficient to make the diagnosis. The decision to remove the first-rank symptoms was because of the evidence showing their low specificity in differentiating schizophrenia from other non-affective psychosis and affective psychosis. ICD-11 values first-rank symptoms equally with hallucinations and delusions of any kind as diagnostic criteria of schizophrenia. ICD-11 removes the subtypes of schizophrenia from ICD-10 as a way of capturing the clinical heterogeneity of the disorder. Subtypes had low diagnostic stability in longitudinal assessments. These categories did not allow for a description of different and independent clinical presentation of psychotic and mood components of the disorder. As per ICD-11, it resulted in a simplified clinical description of the disorder. ICD-11 introduces symptom specifier to replace the subtypes of the schizophrenia. The specifier is constantly assessed throughout the course of the disease as severity of the clinical manifestation varies between patients in same patient at different times. The specifier categories include positive, negative, depressive, manic, psychomotor, and cognitive deficits. It could allow for a more accurate and dynamic capture of the different symptoms of schizophrenia. The course of the disorder in ICD-10 was divided into continuous, episodic, remission, and uncertain course. These specifiers were changed in ICD-11 to first episode, multiple episode, continuous course, and unspecified. Thus, ICD-11 provides a better registration and better longitudinal study of the disorder for its initial stages. The course specifiers in DSM5 are first episode currently in acute episode, first episode currently in partial remission, first episode currently in full remission, multiple episodes currently in acute episode, multiple episodes currently in partial remission, and multiple episodes currently in full remission with continuous unspecified. And as per ICD-11, it's first currently symptomatic episode, first episode in partial remission, First episode in full remission, first episode unspecified, multiple episodes currently symptomatic, multiple episodes with full remission, multiple episodes in unspecified, continuous currently symptomatic, continuous partial remission, continuous in full remission, continuous unspecified schizophrenia and unspecified schizophrenia. ICD-11, ICD-10 versus DSM-5. Although ICD-10 and ICD-11 and DSM-5 require that psychotic symptoms last at least 1 month to make the diagnosis of schizophrenia, DSM-5 additionally requires these symptoms along with the prodromal or residual symptoms to be present for 6 months. Impaired functionality at work, interpersonal or self-care level is a diagnostic criterion of schizophrenia in DSM-5 and is not considered in ICD-11 and ICD-10. ICD argues that functional deficits do not occur in people with people in schizophrenia and therefore not specific to the disorder. ICD-11 and DSM-5 have made the similar changes in the description of schizophrenia. Both remove the subtypes of the disorder. DSM-5, like in ICD-11, incorporated a symptom specifier in the assessment of the clinical manifestation of schizophrenia. In DSM-5, the symptom specifiers are delusions, hallucinations, abnormal psychomotor behavior, negative symptoms, cognitive impairment, depression, and mania. Catatonia is removed as a subtype of schizophrenia, which is handled similarly in both ICD-11 and DSM-5. ICD-11 considers that catatonia can be caused by mental disorders, psychoactive substances, and by medical conditions. Catatonia by mental disorders, it is assessed with symptom specifier under the category of psychomotor symptoms and in other two cases as a secondary presentation. Catatonia in DSM-5 is assessed as an independent specifier with catatonia. Similar course specifiers between ICD-11 and DSM-5 enable a comparison of a different course patterns that schizophrenia could follow. In conclusion, ICD-11 conceptualized schizophrenia from a categorical approach. It made changes in the diagnostic criteria by removing of the Snyder's first-time symptoms, changes in specifiers like removal of the subtypes, changes in symptom and course specifier. Changes in the specifier in ICD-11 and DSM-5 are similar. One difference being the difference in management of catatonia with ICD-11, considering it as a symptom specifier, and the DSM-5 evaluating it as an independent specifier. Thank you. So these are my
questions, comments? ICD-10 reference. Take it from ECD, CDG. Not a reference. ICD-10 subtypes. Which one we use? How many versions of ICD-10 are there? For instance, I have seen this luxury of missing the tablets. Those are really good. You will not be good at it. They are standing most of the thing. जो जो इंटर्न्स यहाँ पे आइडिया होता ही हम लोग बैठे people who miss the tablets they have fun day. I'm not pointing. Next time, should be the line, the seniors are there. So, any other subtypes of ICD, versions of ICD, is an ICD, clinical guidelines, There is a diagnostic criteria version. There is a primary healthcare version. Then there is a multi-axis version also. Version. So it's yeah. So what is the basic difference? Just about ICD can be here.
The basic difference is the removal of the subtype.
ICD level, what is the criteria of this?
In the diagnostic, it should meet, it should be present for at least 1 month.
What also? Except that they have removed FRS. Or they have removed that one, the A2, D1 criteria, E2I, E2 criteria.
So they have removed the subtype, criteria.
Criteria is the same. Criteria same. So FRS को हो गया उसमें. You said ना FRS नहीं है. ICD. ICD level criteria है. You have ICD level. ICD 11 का है. इंटरनेट पे अवेलेबल है. तो नहीं है पर इंटरनेट पे अवेलेबल है.
ICD 11 means
ICD 11 is available online. There is a browsing tool. Open the spread, you click on it, and then all the not only for psychiatry, all the disorders, the criteria are stop the recording, stop the sharing.